The thought of having a heart attack alone after 60 is frightening, but with the right knowledge, you can take control. Learn 7 proven, life-saving actions that could double your chances of survival. Be ready because your life matters. Recognizing specific heart attack warning signs in older adults. It's not just typical chest pain. When it comes to heart attacks, many people often picture someone suddenly clutching their chest, their face contorted in severe pain, an image commonly seen in movies. However, for older adults, especially those over 60, the warning signs of a heart attack can be very different and much more subtle. In fact, according to the American Heart Association, nearly 40% of seniors experiencing a heart attack never feel the classic crushing chest pain at all. Early recognition of these atypical signs is the crucial first step that can determine survival. One of the earliest and most often overlooked signs is unusual fatigue or sudden weakness. This isn't the normal tiredness after a day's work, but a profound, unexplained exhaustion that makes the body feel distinctly different. Next is shortness of breath, especially with minimal activity or even while resting. If you suddenly find yourself gasping for air walking to the mailbox, when yesterday was no problem, that's an alarming sign. Sudden cold sweats, unrelated to ambient temperature or physical activity, are also a symptom to note. Many older adults also experience nausea, indigestion, or discomfort in the upper abdomen, easily mistaken for common stomach problems. Lightheadedness, dizziness, or sudden confusion can also be signs of a heart attack, sometimes being the only symptom in older adults. The pain doesn't necessarily have to be in the chest. Be wary of unexplained pain in other locations, such as the jaw, neck, back, especially between the shoulder blades, or in one or both arms. Finally, sleep disturbances or increasing fatigue in the days or weeks leading up to a heart attack have also been reported. Research shows many seniors experience these warning signs up to a week before the actual heart attack occurs. Notably, women over 60 tend to experience less obvious symptoms like fatigue, shortness of breath, and nausea more often than chest pain. Never ignore these signs. If you feel something is not right, especially when several symptoms occur simultaneously, trust your intuition. Early recognition and immediate action are the first keys to saving yourself. Life-saving action. Call emergency services immediately. Absolutely do not drive yourself. As soon as you suspect you or a loved one is showing signs of a heart attack, the most important and urgent action is to call 911 immediately or your local emergency medical number. Don't hesitate. Don't try to endure it or wait to see if the symptoms disappear on their own. During a heart attack, every minute is precious because time is heart muscle. The sooner medical intervention is received, the higher the chance of saving heart muscle and minimizing damage. A serious mistake many people make is trying to drive themselves to the hospital. This is extremely dangerous for several reasons. Firstly, driving requires concentration and exertion, which adds further strain to an already struggling heart. Secondly, your condition can worsen suddenly while driving, leading to loss of consciousness and causing a serious accident for yourself and others on the road. Conversely, when you call 911, professional medical help is activated immediately. Modern ambulances are equipped like mobile emergency rooms. Paramedics can begin life-saving treatments on the spot, such as administering oxygen, necessary medications, and even performing CPR or using a defibrillator if needed. More importantly, they will notify the hospital of your condition in advance, so the cardiology team can be ready the moment you arrive. After calling for help, if you are still able, unlock your front door so that medical personnel can easily access you, even if you become unconscious. Remember, calling for help is not a sign of weakness or overreaction. It is the smartest and most decisive action to protect your own life. Taking aspirin correctly, an important supportive step while waiting for an ambulance. In those critical moments waiting for medical help to arrive, a familiar pill from the medicine cabinet can play a key role. Aspirin. Aspirin works by preventing platelets in your blood from sticking together, helping to limit the growth of the blood clot obstructing the coronary artery, the main cause of most heart attacks. Research shows that taking aspirin correctly during a heart attack can significantly reduce mortality rates. However, aspirin use needs to be correct and timely. After calling 911 or your local emergency number, and only if you have no contraindications, such as an aspirin allergy, a history of bleeding disorders, are currently taking blood thinners, or have been advised by your doctor not to use it should you take this step. The recommended dosage is 325 milligrams of aspirin. This is equivalent to 1 regular adult aspirin tablet or 481 milligrams baby aspirin tablets. The most important thing is not to swallow the tablet whole immediately. Instead, chew the aspirin thoroughly before swallowing. Chewing helps the medication absorb into the bloodstream much faster, in about 5 minutes compared to 30 minutes if swallowed whole. You only need a very small sip of water, just enough to help swallow the chewed medication. Don't forget to inform the 911 dispatcher and the paramedics when they arrive that you have taken aspirin, the dosage, and the time you took it. This simple action can make a big difference. But remember, aspirin is only a temporary supportive measure and cannot replace professional medical care and timely intervention by a doctor. The right position: reducing strain on the heart while waiting for help. While waiting for medical assistance when a heart attack is suspected, choosing the right position can make a significant difference, helping to lessen the burden on the struggling heart and improve oxygen circulation. Contrary to the common belief that lying flat is best, the appropriate posture will depend on the specific symptoms you are experiencing. If you are experiencing shortness of breath, a common heart attack symptom, especially in older adults, choose a sitting upright position with good back support, often called the high Fowler's position. This position helps the lungs expand maximally, making breathing easier and reducing pressure on the heart. You can bend or straighten your legs according to your comfort. In case you feel lightheaded or dizzy, sit leaning back at about a 45-degree angle, ensuring your head and back are supported. This posture helps maintain better blood flow to the brain without putting too much extra pressure on the heart. If you feel nauseous, sit upright and lean slightly to your left side. This position can help prevent aspiration if you unfortunately vomit. Regardless of the position you choose, it's important to avoid any strenuous activity. Don't try to stand up or walk around. Loosen any tight clothing, especially around your neck, chest, and waist, to make breathing easier and not restrict blood flow. If you feel cold and shivery, often due to cold sweats, cover yourself with a light blanket, as shivering also increases the heart's workload. Finally, try to choose a stable location near the unlocked front door so that medical personnel can easily find and access you. These small adjustments help keep your body in the best possible state while awaiting professional intervention. Controlling your breath 478, a natural therapy to reduce heart stress. When facing a heart attack, panic is a natural response. However, this panic increases adrenaline, causing the heart to beat faster and breathing to become shallow and rapid, all of which put additional pressure on an already compromised heart. Actively controlling your breath, especially using the 478 breathing technique, can help calm the nervous system, reduce stress on the heart, and improve oxygen supply. The 478 breathing technique is a simple yet powerful method for calming your body and mind. To perform it first, try to sit in a comfortable, supported position as mentioned in previous steps. Place the tip of your tongue against the ridge of tissue just behind your upper front teeth and keep it there throughout the exercise. Begin by exhaling completely through your mouth, making a gentle whoosh sound. Then, close your mouth and inhale quietly through your nose to a mental count of 4. Next, hold your breath for a count of 7. If you find it difficult to hold your breath for that long, especially if you are short of breath, hold it for as long as is comfortable, even if it's just for a count of 2 or 3. Finally, exhale completely through your mouth again, making that same whoosh sound to a count of 8. Repeat this cycle at least 4 times, or continue until medical help arrives. Focusing on your breath not only helps to naturally slow your heart rate and lower blood pressure, but also provides a sense of control during a frightening situation, helping you stay calmer while awaiting professional assistance. Self-administered chest compressions, a last resort when losing consciousness. In an extremely critical situation where you are alone and feel you are about to lose consciousness while waiting for emergency services due to a suspected heart attack, there is a controversial self-first aid technique that might be a last hope: self-administered chest compressions. It must be emphasized that this is absolutely a last resort, only to be considered when you clearly feel yourself fading and have no other options. It cannot replace proper cardiopulmonary resuscitation, CPR, administered by someone else. If you find yourself in this situation, quick action is essential. First, Immediately lie down on a hard surface, preferably the floor, not a bed or soft couch, as they will reduce the effectiveness of the compressions. Next, make a fist with one hand. Use the knuckle side of your fist, not the palm, and place it in the center of your breastbone, sternum. Use your other hand to place on top of that fist to add force. Then, use the force of your top hand to push your fist firmly down into your chest, about 5 centimeters, 2 inches deep. After each compression, release the pressure to allow the chest to recoil fully. Try to maintain a steady rhythm of compressions, about 100 times per minute. One way to estimate this rhythm is to think of the beat of the song "Stayin' Alive" by the Bee Gees, a song often used in CPR classes. Continue this technique until help arrives, where you feel more stable. Although there are certain risks, especially for older adults, such as the risk of rib fractures, in a situation where life is severely threatened, this effort may help maintain some blood circulation to the brain and heart, extending the chance of survival until professional help arrives. Preparing an action plan, the golden key to dealing with a sudden heart attack. Facing a heart attack, the mind often becomes clouded, and the ability to think clearly and make sound decisions is significantly impaired. Therefore, preparing a detailed action plan in advance is not just advice, but an important protective shield, especially for older adults. Start by creating an emergency medical information card. This card should clearly state your full name, age, existing medical conditions, current medications including dosages, allergies to medications or food, and contact information for emergency contacts. Keep one copy in your wallet and another in an easily visible place at home, such as on the refrigerator door. Next, keep aspirin, chewable, non-coated type, in several easily accessible locations at home and also in your purse or wallet when you go out. Don't forget to save emergency contact numbers, ICE, in case of emergency, in your phone's contact list, so emergency responders can quickly notify your loved ones. If you live alone or are at high risk, consider using a personal medical alert device. Ensure your house number is clearly marked and easily visible both day and night, so that ambulances do not waste time searching. Equally important is to practice the steps in your plan. Try to visualize and rehearse the actions, where you would sit, where the aspirin is located, the quickest way to unlock the door. Finally, discuss this plan with family, friends, or close neighbors. For those with diagnosed heart conditions, consult your doctor about whether you should keep nitroglycerin at home. This thorough preparation is how you proactively protect your health and increase your chances of survival.